What's going on? Hello, this is Delaney James, and in this presentation, we are going to talk about fluid acid balance, more specifically related to metabolic acidosis and some compensations for metabolic acidosis that our body has built in. So, these are the objectives that we are going to cover. First off, we're going to cover what acidosis is in general, and then move to defining metabolic acidosis. Then we will look at four more major causes of metabolic acidosis, as well as some compensation efforts to return the pH back to normal. A research article that focuses on a system to compensate for metabolic acidosis in patients with renal failure will be discussed because trying to restore their fluid acid balance doesn't quite work because their renal system can be in failure. So first off, what is acidosis? The relationship between hydrogen ion concentrations and concentrations of members of a buffer are paired. So changes in a hydrogen concentration are reflected by changes in the ratio of bicarbonate and carbon dioxide, with the normal ratio being 20 to 1 with a pH of 7.4. Anytime the bicarbonate or and carbonate, excuse me, anytime the bicarbonate and carbon dioxide ratio falls below that 20 to 1, acidosis exists. And so, due to the Henderson-Hasselbalch equation, it should yield a pH below 7.4, moving us to a more acidic uh, value on the pH scale, meaning poor in health. While this does say good health is more alkaline, we do start to see uh, metabolic alkalosis and respiratory alkalosis when we start to become too basic. However, we are not going to reference that. We would like to stay around 7.4, which is right where my cursor is when we are referencing our blood pH and the pH within our body. Acidosis is when we start to see more acidic pHs in the 6 to 4 range over here. So, what is metabolic acidosis? So, by definition, metabolic acidosis includes all types of acidosis that are caused by an excess, um, besides ones that are caused by an excess of carbon dioxide within the bodily fluids. That is known as respiratory acidosis. Metabolic acidosis is always characterized by a reduction in the plasma concentration of bicarbonate. However, carbon dioxide concentrations will remain normal. So, this would produce an acidotic ratio of 10 to 1, which is less than our 20 to 1 ratio that we just discussed. Bicarbonate is produced naturally within the body. It is a byproduct of metabolism, hence metabolic acidosis. The blood is going to bring bicarbonate to the lungs, and then it is exhaled as carbon dioxide. And the acid base balance comes into play because our kidneys help to regulate the bicarbonate levels within our body, and they do this by excreting and reabsorbing bicarbonate, which in turn will regulate the pH within our bodies. The reduction in bicarbonate concentration can come from either an increased loss of bicarbonate rich fluid. So, if we're losing fluids that are rich in bicarbonate, we can start to see that concentration reduce, or from the accumulation of acid that simply is just not bicarbonate. Any acid that will take the place of bicarbonate will change bicarbonate's concentration. Here's just a simple pictograph that kind of summarizes all of the symptoms of metabolic acidosis. We start to see headache, low blood pressure, um, warm, flushed skin, nausea, vomiting, and the causes here. We are going to go over those on the next two slides in more detail. So, what are some causes of metabolic acidosis? So, we're going to do two on the slide, two on the next slide. Metabolic acidosis is a fairly common acid base disorder. However, it does have a few common causes. The first being severe diarrhea. I know that's gross. Um, however, it is a way that our body loses bicarbonate. So during digestion, um, a bicarbonate rich digestive juice is usually going to be secreted into the digestive tract, into the pancreas, and then it's going to be later reabsorbed back into the plasma when digestion has been completed. So we have this rich bicarbonate juice being secreted into the digestive tract and then being reabsorbed throughout digestion. However, when someone suffers from severe diarrhea, this solution is lost from the body instead of being reabsorbed. So, this leads to the obvious decrease in bicarbonate. That bicarbonate rich juice is lost, it's not being reabsorbed. Bicarbonate is lowered in concentration within our body, meaning that our hydrogen ions are no longer being buffered. Um, so, they are available within the bodily fluid, increasing the uh, hydrogen ion concentration, which would decrease the pH. The second cause of metabolic acidosis is diabetes mellitus. And this is simply because fat is metabolized abnormally because the cells cannot use glucose due to the inadequate supply of insulin. This results in an increase in our keto acids being produced, raising the plasma concentration of hydrogen ions. So, this will push the pH in the body toward a more acidic pH value, giving us these symptoms of metabolic acidosis, giving us tachycardia, accelerated heartbeat, fatigue, loss of appetite, dizziness, weak, and headache. Some of the other symptoms that were mentioned on the other slides as well. Two more causes of metabolic acidosis. The third is strenuous exercise. This can cause metabolic acidosis because when we are using our muscles, they resort to anaerobic glycolysis during super vigorous exercise. And so during anaerobic glycolysis, we are producing lactic acid or lactate. This lactic acid will raise the concentration of hydrogen ions in the plasma, which would decrease pH. The last common cause of metabolic acidosis is uremic acidosis. Uremia is just severe renal failure. So in this condition, the kidneys have trouble either getting rid of normal amounts of hydrogen ions that are created from a non-carbonic acid, um, that are formed by the metabolic process. This leads to an increase in hydrogen ions within the body fluid. Along with not being able to get rid of hydrogen ions, our kidneys also have a horrible job at conserving an acceptable amount of bicarbonate to buffer that normal acid load. So not only do we have trouble getting rid of hydrogen ions, we have trouble conserving bicarbonate as well when we have uremic acidosis. So here is the normal acid base balance. Here is the Henderson-Hasselbalch equation to determine the pH. Here's kind of like a scales and balance diagram of it. We have that 20 bicarbonate to 1 carbon dioxide ratio that we'd like to see. This is normal, right? Our balance is, our beam is balanced, our pH is at a 7.4. This is where we want to be. However, when we enter into metabolic acidosis, we will see that beam shift out of balance. So, how does our body fix metabolic acidosis? It can be compensated by respiratory and renal mechanisms as well as chemical buffers. However, this is not how the body can respond during uremic acidosis, essentially because it is renal failure, and the renal mechanism would just not work. For the other causes that I mentioned, Metabolic acidosis is compensated by buffers either taking up extra hydrogen ions or the lungs are blowing off extra hydrogen ions, generating carbon dioxide, or the kidneys are excreting more hydrogen ions and conserving more bicarbonate. So it all has to do with how many hydrogen ions, that acidic portion, and how many bicarbonate ions do I have in my body, changing the acid base component. So these things help restore the ratio back to normal by dropping carbon dioxide concentrations to 75% of the normal and raising bicarbonate concentrations halfway or about 50% toward the normal. So we're going to decrease carbon dioxide, increase bicarbonate in order to restore that ratio roughly to that 20 to 1 normal that we just talked about. The shift in carbon dioxide concentrations is very important because in respiratory acidosis, this would actually be the cause of that type of acidosis. Uh, However, in regards to uremic acidosis, the respiratory system can only compensate for approximately that 75% back to normal. The kidneys would not provide that extra help, so pH could not be restored all the way. So here is that out of balance that I was just talking about. On the right side of this diagram, that is the normal um, compensation for, metabolic acidosis. We don't quite see that 20 to 1. We'll get 15 to 7.5, which roughly brings us back to the same pH of 7.4. Here on the left side is when we see that out of balance with our beam. We start to see a decrease in the bicarbonate, which throws off our ratio. Notice how carbon dioxide has not changed. This is not respiratory acidosis. It's all metabolic. So the thing that's changing is the bicarbonate. So when we decrease this value, that ratio is thrown off and our pH decreases slightly to 7.1, pushing us towards a more acidic environment. So I kept saying our body doesn't have a way of fixing uremic acidosis because if your organs aren't working, obviously it's not going to restore that acid base balance. So this paper aimed to research a method of direct removal of that acid within patients who suffer from metabolic acidosis and renal or respiratory failure. This paper did also look at respiratory acidosis. However, for the sake of this presentation, we're going to focus on metabolic acidosis. They wanted to demonstrate proof of concept for the Advanced Organ Support or ADVOS system. It is a renal support therapy based on albumin dialysis. And so this paper just really wanted to figure out if this could work for patients who suffer from renal or respiratory failure. Their methods include an ex vivo model of continuous carbon dioxide supply or lactic acid infusion, one for respiratory, one for metabolic. This was done using porcine blood. These samples were exposed to hemodialysis with that ADVOS system. A multitude of parameters were tested, including blood and dialysate flow, different dialysate pH settings, and acid base concentrate compositions. These test results were then compared to standard continuous veno-venous hemofiltration using high bicarbonate substitution fluid, and continuous veno-venous hemodialysis was also conducted. So we compare this to what normally happens within our blood when we use hemofiltration. The results showed that continuous lactic acid infusion, excuse me, this pollen is killing me, sorry. That continuous acid acid infusion was able to compensate for 3 millimoles per minute of an acid load. When acidosis was triggered, the ADVOS system multi-normalized the pH, and bicarbonate levels returned back to normal within 1 hour. The major determinants to correct the blood pH were blood flow, dialysate composition, and initial acid-base status. Excuse me. The ADVOS system was able to remove more than 50% of the amount of carbon dioxide that was typically produced by an adult human, and the blood pH was maintained at a stable pH value within the physiological range through that compensation of a metabolic acid load using the albumin dialysate that the ADVOS system uses. The body can't compensate on its own using respiratory and renal functions, like I've mentioned before, but when the body can no longer compensate for itself, it is important to find a method in which patients can buffer those hydrogen ions or conserve bicarbonate in order to relieve that metabolic acidosis. And this ADVOS system did do that. This paper does argue that it does need to be tested in human patients in order to come to a solid conclusion. Here is the first half of figure 1. I split it up so y'all could see it better. Here we are comparing the course of blood pH during treatments with the ADVOS system, and this is the pH of what we were usually doing. The CVVH was the normal way of treating this. As you can see, that metabolic acidosis was triggered in blood reaching a baseline value before treatment at a pH of approximately 7.2. However, when we get to 7.2, we start to see an increase in our pH starting to balance us back out towards that 7.4. Oh, I lost my cursor. Towards that 7.4 here. However, with our traditional way of treating it, our pH doesn't exactly start to balance out or increase. It starts to become more acidic over time. So this is the graph that argued that this treatment, the ADVOS treatment, does help return the pH back to normal, including treatments with renal failure. Here we were looking at carbon dioxide pressure and concentration of bicarbonate over time with the two treatments. While this wasn't necessarily looking, this wasn't looking at, oh my gosh, respiratory acidosis, the pressure of carbon dioxide was important in metabolic acidosis. What is this doing? I'm so sorry. Here we just see that the millimoles per liter of bicarbonate remained quite constant with the ADVOS and the normal treatment that was usually used, that's CVVH. So this figure right here didn't exactly prove that the ADVOS system was helpful in treating metabolic acidosis, hence why they wanted to do further study to conclude their results and back them up. Here are my sources.